Dad, where have you been? I've been waiting an hour.
What do you mean?
You were supposed to pick me up from school. I had to walk home.
Oh, shoot. I'm so sorry, honey. I haven't been getting enough sleep lately, and I have a huge headache. And I even forgot to go to my rugby game yesterday.
You should go to the doctor. You haven't been sleeping well.
Yeah, I think I should.
All right, class, listen up. Case study time. Let's see if medical school taught you to do anything other than regurgitate facts about random diseases. A rugby player walks into a bar. Just kidding, he came into the clinic complaining of a headache and confusion. What do I do?
Could be a concussion. Rugby players are often subject to traumatic injuries, so it's not unlikely that he hit his head. Give him some Tylenol and send him home. Next.
He said he didn't hit his head.
Concussion symptoms can take a while to manifest. Let's check his blood for tau buildup. Concussions cause high levels of the protein tau to accumulate, making an easy way to see if he's still being affected.
Blood test shows an accumulated level of tau.
Great. As I said, Tylenol, then send him home.
Great, he's all better. Not, thanks to your incompetence, the patient comes back a week later complaining of confusion, incompetence, difficulty functioning in his daily tasks, and shakiness. What else could it be? No, someone less inept, please.
How old is he, though? Before doing any diagnosis, we should take a medical history.
So he's 43 years old, no history of mental illness, no familial heart disease, cancer, or psychiatric conditions.
So probably not Alzheimer's then. He's on the young side anyways, no family history. And besides, Alzheimer's progresses slowly. What about a UTI? In some cases, it can cause mental confusion and functional debilitation. Take a urine sample and test for a culture of E. coli bacteria, which is the most common cause.
Culture is negative for E. coli and all other common causes of UTIs.
Well, it's possible to have a negative culture even if they have a UTI. Check the urine for white blood cells. It's a sign of a non-bacterial infection.
Culture is negative for that too. Give up on the UTI already. What else do we have?
It could be hydrocephalus.
Hydrocephalus, interesting. The abnormal buildup of fluid in the brain.
It will cause the incontinence as well as the confusion. If we take an MRI, enlarged ventricles could be a diagnosis of hydrocephalus.
But it doesn't explain the extra tau in the brain.
He's a rugby player. He could have tau buildup from a previous head injury and currently have hydrocephalus.
Or what if he does have Alzheimer's? Sure, he's on the young side, but the tissue atrophy caused by Alzheimer's explains all his symptoms. The confusion, incontinence, tau, it works.
There's no family history, though. Alzheimer's has a significant genetic component, particularly early onset. He's way below the standard age, so if he did have Alzheimer's, he would have to have a relative that has it as well.
Familial Alzheimer's increases the risk, and most commonly, those who have early onset Alzheimer's do have family members with the disease, but it doesn't always happen like that. He should be tested to be safe. There's no cure for Alzheimer's, so treatment needs to be started immediately in order to prevent progression.
Great, so how do we check for Alzheimer's?
How about a simple memory test? If he does have Alzheimer's, there would be a significant memory loss. We could do a SAGE, the self-administered geocognitive test. We use it all the time when we want to diagnose Alzheimer's patients or patients with dementia.
Great, Marina, run the test.
Okay, Jay, I'm just going to get you to fill out this test. It's just to check your cognitive abilities, so please answer every question. Okay.
What did the SAGE show?
Significant memory loss for his age, but that could be due to many illnesses, so we should run an MRI just in case of brain atrophy, which is significant brain tissue loss, which is typical of an Alzheimer's patient.
Kirthi, schedule an MRI to check for more definitive signs of Alzheimer's and look for biomarkers in the cerebral spinal fluid. Also check for genetic risk factors for Alzheimer's since he's so young.
Here's the MRI.
Great, what do we see?
So you can see some atrophy in these areas here. Given that the amount of tau is also high for someone his age and that the cerebrospinal fluid showed patterns of proteins that is typical of this disease, I'm fairly certain he has early onset Alzheimer's. The genetic test also revealed a mutation in the presenilin genes, which is the strongest indicator for early onset Alzheimer's.
Okay, so to Alzheimer's. Dr. Cameron, break the news.
Hi, I'm Dr. Cameron. Please have a seat. I have some bad news. Unfortunately, you have Alzheimer's disease.
No, I'm only in my 40s.
We think that you have early onset Alzheimer's. It's not common in your age group, and it's more common in women, but it can happen. I want you to know that we're going to try our best to slow the progression, and you can still have a fulfilling life.
Slow the progression? You mean there's no cure?
Unfortunately, no, we don't have a cure at the moment. The best treatment available is donepezil.
That's why I haven't been sleeping very well. So what further steps should I take?
Your home environment is very important, so try to keep everything at the same place. So for example, your keys, your wallets, and other important things, and try to reduce clutter so you can remove excess furniture, and you can also have pictures of important things around your house. Another important thing is to try to have a balanced diet and exercise daily.
What about work? Will I still be able to do what I do on a daily basis?
I think so. You can talk to your employer about switching to a role that's more suited for your symptoms. So for example, you can do something more repetitive.
The brain is composed of specialized cells called neurons. A typical neuron is composed of a cell body, dendrite, and an axon. The cell body contains the nucleus, which is the control center of the cell. It also has several tree branch-like structures called dendrites, which may receive chemicals from other neurons. The long tail of the neuron connected to the cell body is called the axon, which transmits signals to other neurons by releasing chemicals called neurotransmitters. These neurotransmitters bind to receptors on dendrites of other neurons. This close proximity between the axon and dendrite is called the synapse. Neurons communicate with one another via these synapses. Alzheimer's disease is typically characterized by neurofibrillary tangles and plaques. First, we will talk about the formation of plaques. Within the cell membrane of neurons, we have abnormal processing of a protein called APP, which stands for amyloid precursor protein. Normally, APP is processed by alpha and gamma secretase proteins. However, within individuals suffering from Alzheimer's disease, the protein APP is cut by beta and gamma secretase instead. Specifically, individuals suffering from early onset Alzheimer's disease have presenilin mutations which cause this abnormal processing. The beta amyloid subunits bind together to form oligomers, which are chain-like structures. These oligomers come together and eventually form plaques. However, the reasons behind the toxicity of the beta amyloid plaques to neurons are unknown. Sometimes beta amyloid oligomers infiltrate synapses, disrupting the communication between neurons. Communicating between neurons allows us to form memories, and beta amyloid oligomers are thought to degrade this ability. Next, we will talk about neurofibrillary tangles. Within the axons of neurons, we have structures called microtubules, which maintain the structure of the axon. The building blocks of microtubules are attached together by proteins called tau. When tau is hyperphosphorylated, microtubule building blocks cannot be held together. Therefore, axons cannot maintain their structural integrity, and this prevents neurons from communicating with one another. Sometimes these tau proteins go through the synapse and travel to other neurons, impairing other unaffected tau proteins. They make them dissociate from the microtubule structure. Thus, when the axons of neurons degenerate, they will not be able to communicate together, which leads to their cell death. Donepezil blocks the ability of the protein acetylcholinesterase from breaking down acetylcholine. Acetylcholine is a chemical messenger important in learning, memory, arousal, and sleep-wake cycles. This medication delays the worsening of symptoms by keeping this chemical messenger available to communicate with the remaining neurons that didn't die. This medication can also slow down the progression of cognitive impairments due to Alzheimer's and alleviate agitation and depression. Some common side effects that come with the drug are appetite loss, trouble sleeping, nausea, and overall weakness. Inform your doctor if you experience some of the more serious potential side effects, like vomiting blood or finding blood in your stool, painful urination, chest pain, or any form of GI inflammation.
So we'll transfer you to Dr. Foreman's office. He specializes in Alzheimer's research and treatment. Best of luck.